Okay, I'll begin. Okay, so family attitudes regarding, so first I'll introduce myself. Natasha Spencer, I'm from Chicago, Illinois. Illinois passed legislation in 2007 to include Krabbe disease as part of their panel. And it took 10 years for them to bring that to implementation. My son Keenan was born in 2011, followed by 4 other families, all with early infantile diagnoses. So our family was the subject of what turned out to be an 8-story Chicago Tribune series that led to legislative hearing that led to the final implementation of testing for Krabbe disease here in Illinois. Kristen, do you have audio yet or no? Okay, go ahead and switch the slide. Switch the slide. Okay. These are our list of authors, 3 of which are family members. We have Dr. Gelb, Tara West from Duke, and of course we all know Anna from Hunter's Hope. Next slide. Okay, so when should a disease be added to the newborn screening panel, the NBS panel? NBS is warranted when a valuable treatment for rare disease exists. The window of opportunity for effective treatment is lost if diagnosed after the development of irreversible symptoms. The natural history of the disease is understood. A high throughput newborn screening test gives minimal number of false positives and negatives. A post newborn screening follow-up plan can be established. Next slide. The history of NBS for Krabbe disease started in New York State in 2006, soon after it was shown that early cord blood transplantation favorably alters the natural history of the disease. NBS for KD was added to additional state panels after New York, including Illinois, Indiana, Kentucky, Louisiana, Missouri, New Jersey, New Mexico, Ohio, Pennsylvania, South Carolina, and Tennessee. KD NBS has been implemented in Illinois, Indiana, Kentucky, Missouri, New Jersey, New York, Ohio, and Tennessee. Patient advocacy played a large role in adding NBS to these state panels, and the requirements to add a new condition to the newborn screening panels differs from state to state. Next slide. The RUSP. The second mechanism for NBS expansion in the US is the RUSP, the Federal Recommended Uniform Screening Panel. It requires a positive vote by the Advisory Committee on Heritable Disorders in Newborns and Children, final approval from the Secretary of Health and Human Services, and then states then try to include all conditions on the RUSP to their individual panels. The history of KD and RUSP. In 2010, by an 8-7 vote, KD was not recommended for addition to the RUSP. The committee asked for additional information about the algorithms for NBS of early infantile KD, as well as more information about the specific benefits of treatment, and it sounds like we are working hard on changing that. Next slide. Precision of NBS for KD. Precision has increased in the past few years. All NBC labs screening for KD first measured the activity of GAL-C in dry blood spots. Anything below the daily cutoff is sent for DNA genotype analysis. Unless the mutation is known, these genotype analyses can be sometimes inconclusive. More recent work has shown that measurements of the lipid biomarker cytosine greatly increases the precision of KD for NBS. Disease-specific ranges have been established for infantile and late onset KD. Cytosine measurements can be made in the same dry blood spot using GAL-C analysis. All states now live for KD NBS either incorporate cytosine measurements as part of NBS or are taking steps to include cytosine testing in their algorithms. Lack of precision going forward for KD NBS is greatly diminished. Our methods.
Kristen, are you there? I thought I saw her join. Oh, okay.
Okay.
Sorry, Natasha.
Yeah.
Oh, she is there.
Oh, yeah, Kristen, go ahead.
You can hear me?
Yes.
You can hear me?
But there's an echo, so
Kristen's,
you're going to need to mute your speakers on your computer.
What about now? Is that good?
Yeah.
That's perfect. Yes.
Oh, sorry.
Kristen's
I don't know
on
what's wrong with my computer. And I'll just introduce myself really quick. I'm Kristen Webb. My family's from Tennessee. Our daughter, Mabry Kate, passed away from early infantile Krabbe disease when she was 11 months old. And just about a month and a half after her passing, our son was born, also with Krabbe. He was born and transplanted at Duke under the care of Dr. Kurtzberg and her team. And he's now 5 years old and is so much fun to be around. We don't know what we would do without him. So that's just a really quick introduction. And again, I apologize about my technical difficulties, but I'll continue with section 2, which is pretty short, but this just explains the method that we use as far as developing the paper. So we together created a family perspective survey using Google Forms was the format, and we sent that out. I know Hunter's Hope sent that out, I think, for the first time in December of this past year. And then I know Natasha and myself and Carlita, we also have our own personal social media pages, so we shared it on that. And then we also got on some family group pages that we are part of to just promote the survey, to try to get as many responses as we could through social media and emails that way. Hunter's Hope also used some email blasts that they sent out and just shared through personal email accounts too, just other people that we may have known. So some of the survey questions, the first few were basic biographical information. When we received the results, we categorized them into 3 different categories, and they're all indicated by their initials there. But the first category is the symptomatic diagnosis, so those families who receive their diagnosis that way. Also, family history diagnosis was the other category, and then lastly was newborn screening diagnosis. The survey also included questions regarding eligibility for transplant and whether or not they received that treatment. Also about whether they have advocated for Krabbe disease newborn screening in their state, and whether they are supportive of newborn screening in the U.S. Or wherever they reside. So the survey also allowed participants the opportunity to answer or to provide comments based off their responses. So if they were in support of newborn screening, they were able to expand on that. Or if they weren't in support of it, they were able to expand on that as well. And that just gave us even more information that we needed to get an overall snapshot of the way that families feel about newborn screening and the importance. Natasha, do you want me to do section 3? Or
Yes, go ahead.
I
And
know
do
you're
section 3. Yeah, go ahead.
Okay. So for the results of the survey, this is just a table that summarizes the number of survey responses. And again, they're categorized in the categories I mentioned previously. So it just shows what percentage was in what group, their relationship to the person that's affected, the country of residence, and then, when their child was born, and then the type of Krabbe that they were diagnosed with. So you could see that the overwhelming majority were the symptomatic diagnosis patients as far as the responses that we received. So in figure 1, this summarizes the Krabbe disease patients in terms of eligibility to receive a transplant and whether they opted for this treatment. So you can see the different categories. For newborn screening, there were 20 responses. 10 were not eligible, and then the 10 that were received transplant. And then in the symptomatic diagnosis, 15 were eligible and 12 received it. And then family history, there were 12 total and 9 received the transplant and 3 were not eligible.
And I want to add in the symptomatic, Kristen, in the symptomatic diagnosis, the 12 that received transplants, the 3 that didn't, one of the 3 that didn't were because their children, the parents declined, their children were the symptoms were too far progressed. And in the family history diagnosis, 3 were not eligible, 1 was a carrier, and 2 had juvenile onset. Go ahead, Kristen.
Okay. So the fraction of each group who advocated for newborn screening in either the state their child was born or currently resides in. So 62% were symptomatic diagnosis, 30% were newborn screening, and 62% of the 12 surveyed were family history diagnosis, and then the fraction of each group who believes that it should be included on the newborn screening panel. For those with a symptomatic diagnosis, 98% believe that it should be, 90% of the newborn screening category, and then 100% of the family history category believe that Krabbe disease should be added to the newborn screening panels.
And then I just wanted to add one thing about the those who advocated for Krabbe disease in their state. In the newborn screening category, the subcategory of carriers, it was interesting to see how compelled they felt to fundraise and advocate on behalf of the disease when they could have easily just walked away. So that was just something a side note. Go ahead.
So this is just another chart that shows that 170 Krabbe and Krabbe newborn screening families were asked, do you believe newborn screening for Krabbe disease should be implemented in every state? And 97% believe yes, and then a small fraction believe no.
Kristen, I'm sorry, Kristen, can you go back? Sorry, I keep having things to add. So no, it's okay. I wanted to add that something that came up in conversation as we were working on this paper was that perhaps there was an incorrect assumption on the part of families that because we know collectively how we feel about newborn screening, that the people that we're associated with, being all of you present today, also know how we feel. And so when you looked at that map, you saw those 11 states, maybe you're only seeing 11 individual families making their, feelings and wishes known. Whereas we as a family see those 11 speaking on behalf of all of us. They just happen to live in Kentucky or Indiana or Louisiana. And this slide clearly speaks for itself. Go ahead, Kristen.
So these are just, as we mentioned earlier, families were given the opportunity to comment on their belief regarding certain questions. So this is just a summary of some of the comments. So all 10 of the newborn screening families receiving a diagnosis of early infantile, they opted for treatment with stem cell transplant. Most of the families indicated that newborn screening for Krabbe disease allowed them the choice to treat their child, and that the treatment offered their child a chance at life. The 5 families who found out their child is a carrier for Krabbe disease all considered the process life-saving and viewed the results as information to protect future generations in their families. Among the 3 families who found out their child has a high risk to develop later onset Krabbe disease, but are now asymptomatic, 2 supported newborn screening and are grateful for the knowledge and opportunity to save potential to save their child's life when the disease does present. But the other one in that category, she had a negative experience with the post-screen follow-up and wished that they had not found out. Of the 2 families who were told that their child was a false positive for Krabbe, 1 supported newborn screening for Krabbe and believed every state should protect newborns from the deadly disease, but the other had a negative experience with their immediate follow-up and found a lack of protocol and information from their medical providers to be traumatizing. And then the 2 newborn screening families that opposed newborn screening for Krabbe disease both cited gross uncertainty in the information given by their medical providers throughout the process as the reason for their opposition.
And that last point is significant and an important finding, and represents an opportunity for us to improve our messaging to these families. And it's going to come up again in the summary in our paper.
So this is a summary of the family history diagnosis family comments. All 12 that fell into the family history diagnosis category support nationwide Krabbe disease newborn screening in the U.S. And they all comment that early treatment would be possible with newborn screening, which would save lives.
And something else.
And then,
I'm sorry. We're
Yeah,
out
I
of
was just
sync.
going to add.
We're talking on top of each other. We're out of sync. Something else about this category here, as I was reading through the comments, it was really hard not to pay attention to the shift in language use. And this is a group of parents that are mentally prepared for diagnosis prior to their child's birth. So they spent this opportunity at this part of the survey expressing their gratitude for the whole process, and especially for organizations that support leukodystrophy families as a whole. So it really speaks to the mental well-being of a family when their education and support resources are highly met. Thanks, Kristen.
I mean, I was gonna say pretty much what you just said. So the summary of the symptomatic diagnosis Krabbe disease family comments. So those with the symptomatic diagnosis, 98% of those families in that group support newborn screening for Krabbe. And so we just kind of wanted to, a lot of them had several comments they wanted to express. So overall, these are some of the reoccurring comments that we saw. Krabbe disease newborn screening is life-saving for babies born with the disease through treatment intervention prior to the onset of symptoms. This one we saw a lot. It is the right of the parents and caregivers to make the informed decision as opposed to the medical providers or legislatures as to whether or not their child will benefit from the available treatment. Krabbe disease newborn screening is the only way to save future babies from what their own children have suffered through. Cost should not be an issue when it comes to saving a life, and then a family zip code should not be the determining factor as to whether or not a child is diagnosed in time to receive the available treatment. And then among the 3 symptomatic diagnosis families who did not support Krabbe disease newborn screening said that they do not support it unless it provides a normal life or a cure for the child. And then one family member stated that it is expensive and not possible in every state. Did you want to add anything, Natasha?
Not to that one, thanks.
Okay.
Here, I'll take over this last section if that's okay.
Yes.
Okay, discussion. Okay, false positives. In the past, false positives were obviously a concern, as described earlier, and actually throughout this all the morning's presentations. The lipid biomarker cycosine has been discovered to be highly diagnostic and prognostic for Krabbe disease. Kentucky was the first newborn screening lab to measure cycosine in dry blood spots as a second-tier test when the initial GALC enzyme was low. And so far, Kentucky hasn't reported any false positives for Krabbe disease. Most states now testing for KD NBS have recently added cycosine analysis as part of their NBS, and the remainder are planning to incorporate the biomarker analysis in the near future. With cycosine as part of KD NBS, the false positive rate will be greatly diminished, well below the false positive rates found in other conditions that states are currently screening for. Follow-up procedure. Not all genetic disease specialists are fully prepared to deal with the follow-up procedures that come with NBS. Recently, the Krabbe Newborn Screening Council has been created to provide guidance to all physicians of children found by KD NBS. And Dr. Orsini spoke extensively about the role of the council in this aspect. So this group is specifically focused on improving follow-up protocols and information provided to patients at risk of later onset KD that are currently asymptomatic, and they're in the process of preparing a publication that provides expert consensus for the management of children who are at risk to develop late onset KD, as well as an update to the earlier guideline chapters on early onset. Okay, our summary. With the new KD NBS guidelines, including cycosine measurements as part of NBS, it is anticipated that less than 3 to 4 newborns will be identified each year per state in the US at significant risk of early or late onset KD. So, and this next point is like a soapbox for me here. So every category of parent in the survey noted dissatisfaction with the information, resources, medical care follow-up protocols available after receiving a positive screen and diagnosis. And we mentioned this earlier with the 2 families who opposed newborn screening for this very reason. And in preparation for this article, we found publications going back as far as 2003 addressing the same concern. And at least 50% of the families that I know have had a similar experience. There was a mother here in Illinois, Kylie Ponce, when her daughter Hayden was diagnosed in 2017, so only 3 years ago. She was handed a piece of paper with the words Krabbe disease written on it and was told to Google it. Now, I personally had the opposite experience. Dr. Daryl Wagner at the University of Chicago was the most respectful and professional, caring as they come. But my point is that it runs the gamut, and we absolutely have to be able to rein that in. So it's clear that education and support resources are as necessary for you as they are for us. And it sounds like we are taking as many measures as we can, steps forward to fill that gap. And I'm hoping that it would be wonderful if that information can follow along with a positive screen. Whoever gets those results, if that information can travel with it, so that medical provider can be as well informed as possible. I mean, I can't express how terrifying it is to receive that information that your child is under severe threat. And it's absolutely imperative that interaction with your healthcare provider is as respectful and trustworthy as possible, because it absolutely sets the tone moving forward. Okay. With the majority of surveyed families supporting NBS for Katie and opting for treatment when it is possible, it's clear that the parents are willing to take on the risks associated with the treatment. And this is in conjunction with the next bullet point here. Families now participate in a social media community to share the defeats and successes with one another. And that means every category of family represented in the survey, whether they've received a transplant, or whether they're symptomatically diagnosed, or whether they come from the newborn screens. We are well informed, and we are highly transparent with one another. And our experiential knowledge and insight are sought after by medical providers and researchers, and are intrinsic to understanding the natural history of the disease to continue to advance Katie treatment. Families sincerely want the next generation of affected children to benefit fully from the treatment options that are available. And we really want to be seen as more than the end of the line consumer. We really want our voice to be considered along the bandwidth of all the stakeholder decision making. So we really see that the way forward is working together. Of all survey participants, 58% have politically advocated for NBS for KD, and a total of 97% feel that Krabbe disease newborn screening should be implemented in every state. So on behalf of the six of us as authors, we just want to thank you for your time, and to Hunter's Hope for giving us this opportunity. And this is all it's all pending publication in the International Journal of Neonatal Screening, and it's a special edition on Krabbe disease. And there's more to that follow-up protocol, I'm sorry, I can't remember the subtext there, the tagline there, but it's pending publication, should be happening very soon.